Okay guys, I just made a video recently explaining the 5 alternative field you should go into if you don't want to go into MD or DO, but you still want to go into the medical field and have that doctorate degree, right? So now I'm going to talk about the field that I talked the most on in that program and that I know the most about, which is pharmacy, right? And the reason I know so much about pharmacy was because my wife is in the doctorate of pharmacy program, and I got her into that program because, long story short, we were going through the MCATs and taking the pre-med classes for her to do a DO program. She always wanted to do the DO program because she wanted the holistic approach to medicine. So she was trying to get into the DO program, and at that point, we weren't getting the MCATs and the GPA required to compete with other students, and at that time, affirmative action was very, very, very much in play at that time. And I'm not just gonna blame it on that. Okay, at that time, if you talk to my wife, she was pregnant and other different other things that would impact her taking the test. So we were looking for a alternative to an MD/DO program so that we could get her into a medical program without wasting any more time. So let's talk about the PharmD program. All right, so getting into the PharmD program, a lot of people think of pharmacy as the field that only people counting pills at CVS or Walgreens or whatever. Now, that is not exactly what pharmacy is, right? Especially doctorate of pharmacy. A lot of requirements for those type of pharmacy field is Bachelor of Pharmacy or Master of Pharmacy. And, like a lot of time, these pharmacy in these kind of community setting, or that would be called a community pharmacy, where they would be the first line to a patient for medicine or for medical advice, and having that type of consultation with a pharmacist, a medical professional, is free versus going to a doctor. You have problem with your insurance, you're waiting in line forever, you have to make an appointment so far in advance. You can just walk into our pharmacy and then talk to a pharmacist about it. And if they say, okay, well, you need to see a doctor about that, or oh, look, take this medication, you don't need to go see a doctor, you could save a lot of money in that way. Now, a lot of people think of community pharmacy as the only part of pharmacy, and that could be further from the truth. Now, if you get a doctorate of pharmacy, a lot of people could pursue a community pharmacy where, a Bachelor of Pharmacy or a Master of Pharmacy could do. You could also do other things with a doctorate of pharmacy, such as working in the hospital. You can be a hospital pharmacist. Now, you could think of like people behind a counter in the hospital. But if you go do your residency, which is a PGY1 or PGY2, will give you the specialty skill needed for you to do other type of pharmacy, like ambulatory care, where you're working with patient, you're taking blood pressure, you have an office like a regular doctor would, and you would be doing their heart, you would and lung, you would do their blood pressure and all those above that you would usually think that an internist would do. But on top of that, laboratory care tend to look at patients, usually older patient, doesn't have to be, there's no age limit, medication, and they would see, okay, this prescription and that prescription is fighting each other. Let's take away this drug, let's take away that drug. Oh well, this drug could have another alternative that wouldn't fight with this other drug, right? Or it might have less side effect or certain things. Having a doctorate of pharmacy gives you a higher level of understanding when it comes to pharmaceutic than an MD or DO with. So you would be a pharmaceutic or a medication expert, right? And there's some group that's fighting with the AMA right now to give pharmacists right to prescribe certain drugs and stuff like that, so they don't need to go through doctors and MD and DO and waste their time anymore, so that they would take some load off it. But that's a whole nother discussion with the AMA in another video. So another field that we could go into as with pharmacy is critical care. Now, this probably sounds more like internist than the laboratory care would. Laboratory care would look at a patient's records and prescription and go through it. And a lot of time, like if you haven't caught on by now, pharmacists tend to have a lot more hand-on interaction with their patients than an MD or DO would, because MD and DO, especially with today insurance and stuff like that, they are stretched very, very thin and they're worked to death. So pharmacists pharmacists have more work-life balance usually than an MD or DO would, and they tend to have better interaction with their patient because they're not fighting with insurance as hard, and they don't need to have nurses come in and then they have more than 10 minutes with the patient than an MD or DO would. So that's one benefits of being a pharmacist, right? There's the second avenue you could pursue in pharmacy, and especially when you have a PharmD clinical care pharmacist, where they would actually have the doctor setting. It's actually more like internist, where they would go over a patient's heart rate and stuff like that, and they tend to do like physicals with the patients and stuff like that, and they can in clinical care kind of like break down to a little bit more range of what you could do. But one of the avenue of clinical care is emergency care pharmacy, where you're working in the hospital right next to another doctor, an MD or DO, and you're working in an emergency room. You are going through drug lists and all different type of drugs that that the doctor might be giving a patient. Like let's say if a patient is having a heart attack and the doctor needs to jab the patient with a certain amount of prescription or certain drugs to stabilize the drug, stabilize the heartbeat. The pharmacist can be like, nope, that drug is going to mess with this other drug that the patient has OD'd on, or this drug the patient is on is going to kill the patient, right? So the pharmacist would be like, okay, well, use this medication instead, or maybe we should try this instead, right? And if you go through a lot of hospital pharmacists, and if you follow a hospital pharmacist, sometimes they actually look at a patient's medication and try to convert that medication from the pill form into other form, because they are pharmaceutic expert, like I said. Like something simple like that a doctor wouldn't know how to do. Like, how do I take this huge pill and make it into like a liquid that a patient that can't eat can ingest or can get into their body, right? And they can work with nurses and other things. Now, another avenue to pharmacy could be nuclear pharmacy, where they could do nuclear isotope. They could work with radiologists. They could work with nuclear physicists, and they could medical physicists, my bad, and they could do nuclear tracing isotope, doing this different type of nuclear and atomic medication, where they would treat a patient with radiation and whatnot through medicine. So that's one thing that a pharmacist could do as well. Also, we could do pediatric, right? Pediatric, where this pharmacists are specializing in medicine for youngings, for kids, maybe at birth and stuff like that. The pharmacist can come into the room and check whether or not this baby needs certain type of medication to keep him or her alive, or to help them grow, or to fight with certain medication, or to fight with certain field or ailment, my bad. So those are a few. There are other component to pharmacy, but hopefully this can give you a little more information about pharmacy and pharmacy specialty. Pharmacy schooling versus MD and DO schooling is that pharmacy, doctorate of pharmacy, is 3 years of in-classroom training, and a lot of these trainings kind of overlap with MD and DO. And if you know anything about the MD and DO, after the first 2 years of the classroom portion, you would have to take the USMLE before you can go on to do your rotation. In the pharmacy field, you do your 3 years. You don't have to take the test until you are graduated, after you've done the 4th year of rotation. So unlike MD or DO, where you have 2 years of rotation and 2 years of in-class lecture, pharmacy is 3 years of in-class lecture and 1 year of rotation. Now, a lot of pharmacy program you can't transfer because their order of operation and their way of doing their classes are different from pharmacy to pharmacy. We have learned this. In me and my wife, we can't transfer school. The classes don't transfer, the degree does. So you need to get a PharmD before you can transfer to another school to do a pros grad or something. So that being said, pharmacy does still need to take exams after they graduate and get their PharmD. So they need to take the bar exam, for not the bar exam. I'm thinking on law. I'm talking about the board exam for pharmacy, right? And then after the board exam, and I'm not gonna give you the acronym to confuse you guys, but you have to take the board of pharmacy exam, and then after you pass that, you can be a pharmacist. But then you also have to take the law exam, and there's two law exams that you have to take. You have the federal law exam, and then you have the state law exam, where you have to take in your state that you want to practice. Now you can take one law exam for one state, and it could cover multiple states, because some state has overlapping law. But you need to check with your state and your law to know if you want to practice in this state, what state bar or what state law you have to take. All right, if you have any questions about pharmacy, things that I haven't gone over. Oh wait, before I stop, I didn't mention I didn't mention residency for pharmacy. Now for pharmacy and and um and MD versus DO medical school, you could do residency. Now, MD DO, you have to do like a residency, and if you have a lot of story of people going to the Caribbean school or international school to do their MD over there, and they come back and they cannot get match, and they some of them commit suicide because they just can't practice, because you are required a doctor, an MD or DO without residency is kind of useless. That's just a useless degree. So with PharmD, that's not the case. You can practice pharmacy with your PharmD, but you can go on to match into a residency program. The residency program is very similar to MDO. MDO, you apply through a website to match with another hospital to take you in for residency. Usually it's 1 to 2 years. It's not like the shortest residency in medicine. MDDO is internist and family medicine, which is 3 years. So that's longer than the longest pharmacy residency, which is 2 years, which is PGY2, right? Self-explanatory name. But to match into PGY1, PGY2, you have to go through like an interview process, and then you have to match with the hospital. It's very similar, and the program is probably very the same as the program that they use to match medical students to their residency, where you would pick and you would rank which level, what hospital you want the most by level, and then they would rank you and the student that they want to take in. So, and then based on that ranking, they kind of match you together. And so to build off of that, after PGY1 in pharmacy, it's kind of a little different. So in pharmacy, when you finish your PGY1, you get your PGY1 residency certificate, but you can go on to the PGY2, but then you have to match again to your specialty. So the PGY1 is overall specialty pharmacy. So you go to laboratory care, clinical care, psychology, nuclear. You go through all of them in your PGY1, and you do a rotation. And PGY2 is when you pick your specialty, and you don't always need your PGY2 to do to get a job in laboratory care or whatever, but PGY2 will help you get a specialty pharmacy that might be very competitive, like nuclear or psychology, something like that. All right, I hope I answered all of you guys' question. Please be sure to like and subscribe, and if you have an agreement, disagreement, if you know something about that, if this video helped you, please comment below, and if you have any more questions as well, comment below. All right, thank you, peace.